Okay, so here we are on Saturday morning, and this is kind of an unplugged version. Here I don't have my tie on today, and I was just having an interesting conversation with Rhonda, an awesome patient who's been coming for years, up at the front desk, and I said, hey, why don't we put this on video so our other friends out there in internet land can hear what we're talking about. So I'll just kind of bring you up to speed a little bit. First of all, Rhonda, you've been a patient here for several years.
Yes.
What would you say, 4 or 5?
5,
Something
yeah,
like
5
that,
pushing
5 years.
6 maybe, yeah.
And then you drive here all the way from
Moreno Valley.
Moreno Valley, and that's about
70 miles.
70 miles one way. And you've been consistent, you've kept your appointments, and we appreciate that. And what did you start out having? What was your reason for coming here? You were referred by a friend.
I was referred by a friend because I had severe migraines. And I'd had migraines for years and all of my life.
And you're in the health profession,
Yes,
right?
I'm a registered nurse.
And so how would that affect your life when you had the headaches? I mean, is there a carryover into your job and how that affects everything?
It was miserable because you have to be pleasant, you have to be the caregiver, you have to take care of other people's needs when your head hurts so bad you can't hardly bend over, you can't think straight, you have to be able to focus and see the light. In a hospital, everything's bright and white. The sanitizer scents, it was very difficult. Very difficult.
And so you come down here about once a month just to maintain things, and this hasn't solved every single health problem that a person could have, but it's been really beneficial for you, and it's helped you with your migraines and a couple of other things. And what would you, as being a nurse, we were talking about some big words. We were talking about deductive reasoning and inductive reasoning up here at the front desk. This is where it really got interesting for me. And inductive is kind of like, Rhonda, coming from the medical community, is you have some information here, maybe a symptom, and then another symptom here, and there's possibly a syndrome, and there's all sorts of effects, and they're trying to find common corollary elements and then treat that with whatever therapy, medication, sometimes needle injections, sometimes surgery and things like that, which of course we want to avoid as much as we can. Whereas chiropractically, the deduction of the big truth, the big thing that doesn't change for anybody ever at any time, being that, hey, the body is a self-healing, self-regulating organism, and the nerve system controls everything. And up here is the most important. So if you don't have a good structural foundation up here, you really don't have much going on. I mean, you're not giving yourself a chance to be in healing mode as much as possible. And so there's room here to connect the sort of holistic, as we were talking about, with the more allopathic models, as long as we have a wisdom in understanding, kind of knowing a little bit about a lot, and therefore we can try, right, whatever procedure, and we either like it or we don't like it. If we don't respond to it, at least we have the wisdom to take now and zoom out and then cruise along and then try maybe the next best thing, lest we get into this web of side effect followed by a side effect from that treatment, and then you got all this other stuff going on. And then, wait, what about that original thing that I was trying to deal with in the first place?
You know, the concern, one of the issues I'm dealing with now is sinuses. And the concern is a lot of sinus medication, it seriously affects your liver. And so if you live on any kind of a sinus medication, prescription or over the counter, it can damage your liver. And as a nurse, and it seems like a lot lately, I'm dealing with patients who have liver issues, which are brought in from using too many non-steroidal anti-inflammatory drugs, you know, pain medicine, that is brought on, of course, you know, the normal things, by alcohol, by drugs, by smoking, by eating incorrectly, eating the wrong foods. And I want to get out of that pattern. The concept is, everything in your body is a domino effect. Everything is the domino effect. You tip it this way and there goes the rest of the dominoes.
Absolutely.
And it all starts with your brain and your spinal cord, your nerves.
Yep.
Because your nerves stimulate your muscles. Your nerves stimulate your eyelids to blink. It stimulates the feeling in your bladder to know whether you need to go to the restroom or not. It stimulates muscle movement. It stimulates everything.
Absolutely.
And your muscles affect your circulation because they expand against your vessels, your veins, which circulates your blood.
Absolutely.
So again, this domino effect. You've got to have your spine in line, your nervous system working to full function.